Hannah from KIRO, you're unmuted.
Okay, so I know we have covered this in the past. I wanted to revisit. There's some reporting out there from the Washington Policy Center that is based on a series of the IDM situation reports over several weeks, suggesting that the protests actually really did lead to much of this big spike that we have seen here recently. I wondered if anyone can speak to that.
Yeah, this is Kathy. I can start. I think on some level, it'll be very difficult to know exactly the impact, the possible impact, and how big it may have been. What I can say is from our case investigation data, we really weren't hearing from a lot of cases that were reporting that they had gone to protests. Now, there clearly were some people, who had gone, and it's hard to know, how many people may have gone and then never got diagnosed and then spread it to other people, in their family, in their community. So, I think it's, as I said, I think a lot of, we may not know exactly the impact it had, but from the data, that we have around case investigations, and I know King County did a really pretty good job trying to ask all the patients that they were interviewing, as to whether they had attended a protest. They just were not finding that a lot of people had, although some had. And as I mentioned, there could be people who did attend and just had mild illness and, never were brought to the attention of public health.
This is John. I would add, and I don't have the data in front of me, but King County also looked at the folks who were reporting to testing sites and whether or not they indicated whether or not they had been at a protest. And those number testing positive were really, really small. I don't recall off the top of my head exactly the number. I think we have it somewhere. And Kathy, I don't know if you remember the number, but again, it was really small, suggesting not a lot of positivity.
Any follow-ups, Hannah?
Just really quick, there's a lot of positive news